Greetings from your doctors at Sandy Springs Pediatrics and Adolescent Medicine PC. As we work through this difficult time with the COVID-19 pandemic, we wanted to ensure that our patients and their families are aware of the measures that we've taken to protect the health of our staff, physicians, and most of all, you.
We are committed to remaining healthy throughout this pandemic as we serve our community and provide healthcare to our patients. Each member of our healthcare team will be wearing appropriate personal protective equipment for the level of care needed for each visit. We will be wearing masks and request that you do so as well. Hand washing and hand sanitizer are required before each visit, within the visit if necessary, and after each visit. We have removed all books and magazines from our waiting rooms and exam rooms. We are continually cleaning each exam room and common areas such as our waiting rooms, doors, and frequently touched hard surfaces. Our staff is monitored for illness and is required to stay home if ill.
We are not accepting any walk-ins. All visits are scheduled appointments. Our practice has modified our schedules to ensure that febrile and ill patients do not interface with well patients. The American Academy of Pediatrics has made a statement that well baby visits and well child visits that are due for immunizations should not be missed. In fact, we strongly are encouraging patients to follow the vaccine schedule as outlined. This is crucial as our mission is to keep infant and children healthy from preventable illnesses. Each appointment that is scheduled is screened for exposure to COVID-19 and for symptoms of the virus.
Sandy Springs Pediatrics and Adolescent Medicine will provide scheduled new baby hospital follow-up visits, well baby visits, annual well checks, ADHD consults, and med checks between the hours of 7:30 a.m. and noon. For those patients who require a sick visit due to fever or other symptoms, we will be scheduling them between the hours of 1:30 p.m. and 4:30 p.m. We understand that there are anxiety and worries about coming into the office for an acute illness assessment. Our concern is that avoiding the assessment has the potential to delay medical treatment for a serious issue. In an effort to limit our patients and their families' exposure to illness, we are utilizing telemedicine visits for appropriate visits that are reviewed and approved by each physician. If this type of visit is deemed appropriate for your child, our staff will provide instructions for preparing for the virtual visit.
Our practice is committed to limiting exposure and practicing social distancing. Once your appointment has been established, our practice is requesting only one parent or caregiver accompany the patient. For parents of newborns who are coming for their first visit after hospital discharge, 2 caregivers are allowed. Patients with appointments are to call when they arrive. Our receptionist will complete your check-in over the phone and process any required payments for your child's visit. We will call your cell phone when we are ready. Our clinical staff will meet you at the door and take you to your exam room. We are trying to limit the number of forms each family has to complete. However, some well visits do have age-required developmental screens. Families can find 2 required forms on our portal. The well checkup form required for all physicals and the MCHAT developmental screening required at 18 and 24 months. When paperwork is required, we are disinfecting each clipboard and pen after each use. We appreciate each of our families and enjoy watching your children grow and thrive. We look forward to continuing to serve you through this health crisis. We will get through this. We will emerge as a stronger community by working together. Thank you for continuing to support your medical home.